Healthcare seems like a loaded term lately, with politics taking center stage over the controversial U.S. Affordable Care Act and the move to set up public and private insurance exchanges. But one thing is undeniable in this debate. Healthcare is undergoing a major transformation, from how it's delivered to how it's managed to how it impacts providers and consumers alike. What will the new healthcare marketplace look like? What role is technology playing in this transformation? And where can you turn for help with the new healthcare paradigm? For those answers and so much more, we turn to two of the top experts, Gartner Research Vice President Robert Booz and Softheon founder, chairman, CEO, and president Eugene Sayan. We have a lot to cover, so let's welcome in Robert Booz. Bob is a vice president and distinguished analyst in the healthcare industry research group at Gartner. Bob, thanks for joining us. And I'll turn it straight over to you.
Hello, this is Bob Booz from Gartner. Today we're going to be talking about healthcare, business drivers, and exchanges, and how those are linked in the market. Today's discussion will be from Gartner. We're the technology company that looks for trends in the market, how technology is shaping the market, and how to make our clients successful in their day-to-day business here in healthcare. We're going to start off with healthcare business drivers of technology. So let's talk first about the forces that are reshaping healthcare IT. We use the term nexus of forces, and that's the intersection of four distinct characteristics. Those characteristics are social, mobile, information, and the cloud. Each of those shapes healthcare IT in different ways. For example, social is looking for opportunities for consumers, patients, providers to collaborate and communicate in new and interesting communities of interest. Sometimes these communities are extemporaneous, formed for a specific need or a specific operation. We look at mobile and how it contributes to that collaborative workflow, allowing information access and an improved patient experience. We look at information, this complexity of data and thirst for knowledge that drives the use of analytics and reporting. And then finally, we look at the cloud, which is seen as a means of reducing costs, improving service, and reducing the time to reach value. So what are the business drivers for technology in healthcare payer organizations? We see 5 distinct yet interrelated pieces of technology that are being affected by these 5 business drivers. They are the changing role of the consumer, a search for growth and value, shifting regulatory requirements, seeking administrative excellence, and coping with a competitive environment. These 5 drivers are pushing the healthcare industry forward in some interesting ways. So let's dive into them a bit more. The first driver, the changing role of the consumer. People are consumers, and then they are patients, and then they are consumers again. So having that information about the emerging role of the individual as a direct buyer of healthcare products is essential. The experiences that they have in an industry, in a retail experience, in their job, helps to shape their desires coming out of the healthcare industry. What is it that they're looking for, and how are they looking for it? And they're improving in knowledge about healthcare. The recent events regarding healthcare reform and its news coverage have driven a greater understanding of how health insurance works. With that has come an increased availability and delivery methods through different channels, the nexus of forces. And what does that mean? Well, we've seen this shift from insurance companies being business to business to a business to consumer, the B2B into B2C world. And that's important. That's where the industry is going. but it's not the end point. We have two more steps to go through. The next step is the C to U, or SEETOYOU. It's the ability to see the customer as a unique buying unit, specialized to what they want and need in a unique way. It's not the microsegmentation of a B2C. It's the incredibly unique experience that each consumer wants. And then from that flows the C to B, this consumer to business, where the consumer is choosing who they want and how they want them. Our next driver is shifting regulatory requirements. Health insurance exchanges, sometimes called marketplaces, are maturing. We are seeing more information available to the consumer in the public exchange, the government exchange, and a growth of private exchange. This is driving new ways of looking at how healthcare is delivered. With it, we're seeing an increase in number of members who are enrolled and therefore additional care that must be delivered, some through the health requirements of the formerly uninsured. We're also seeing that the public relations and the politics related to healthcare payers is increasing in complexity. In some cases, healthcare payers are paying the price for years of care and service that were under-optimized. But the bottom line here is that the role of the government in the day-to-day operations of organizations is increasing. And with that, standardization and, hopefully, improved access. We are seeing a driver in a search for growth and value. Organizations are looking at the rise of the non-employee, small group, or affinity-based customers. These are people, usually in that C to B group, who look for healthcare coverage in ways that are unique to them. With that, we're seeing more outcome-based provider payment mechanisms. They become more mainstream rather than the traditional fee-for-service. We're also seeing, though, health plans that are losing their way as far as what their key business is. They're asking themselves, what business are we really in? And with that comes a need to redefine the organization, move it from the underwriting and value creation to more of a care management and medical quality state. Government programs are becoming more and more attractive, particularly if there is a safety floor created by the funding related to the Affordable Care Act, Obamacare. So with that, what we're seeing in this search for growth and value is that the traditional value proposition that payers have worked under for years is no longer adequate to help them move forward into the future. Next, we're seeing as a driver, seeking administrative excellence. That's maximizing the execution of customer-facing deliverables through better product and service. And for healthcare technology professionals, IT is being constantly challenged to support new business initiatives. With that, they're hunting for better benchmarks, more relevant benchmarks, and the ability to have some absolute comparisons to how they are doing and relative comparisons to how their competitors are doing. Finally, they're looking at IT solutions to support new business initiatives. When the Cold War ended in the United States and the Soviet Union, there was what was talked about as a peace dividend, where military spending could go down because the Cold War had ended. We think that there is a possibility to create a peace dividend analogy for healthcare IT. that the significant investments related to spending on compliance activities, spending on regulatory activities is going to slow. And with that, more money can be made available in the budget, even if the budget doesn't increase in itself. This more money can be made available to improving administrative operations. We see a bright time ahead for organizations who are trying to improve themselves. And then finally, a driver we like to look at as coping with a competitive environment. This is looking at a marketplace that is fundamentally changing and leverage the information and data assets as a market differentiator. It is taking what the organization already has and improving the information flow and improving the opportunity to use that information flow as a competitive differentiator. We are also seeing new competitors emerge, the so-called risk-bearing provider entity, sometimes called the Affordable or Accountable Care Organization. This risk-bearing provider entity is an organization that is taking on some of the financial risk associated with medical care, medical cost, and medical outcome. With this is a change from the so-called entrepreneurial physician, a physician who is both a practitioner of the healing arts and a small business person. Replacing this entrepreneurial physician is the rise of the mega provider. This is the consolidation of hospitals, multiple hospitals, providers, provider groups into a healthcare organization, this so-called care delivery organization that is competing against other care delivery organizations and in some cases acting like a collective bargaining agent on behalf of providers. So we have these business drivers that are changing healthcare technology. With that, we come up with healthcare payer priorities. What are they doing to cope with these changes in the market? In Gartner, we handle a lot of inquiries every year from our clients and from others at times. We see industry trends because we're in the trenches. And in the trenches, what we're seeing are these areas of investment. In the empowered consumer, it's the branding and marketing and social and mobile, the nexus of forces to improve the consumer's decision-making ability. It also recognizes what we call the consumer of one, the individual who is making healthcare choices for themselves, by themselves. To do that, they need better healthcare management. That's improving care management applications, better clinical analysis, improving health and wellness, and better integrated communications. To do that, more information through business intelligence and analytics, through BI and analytics. It is the stakeholder reporting, the data warehousing, the data quality, and overall taking information and moving it around to come up with new ideas. To do that, we have to improve the IT infrastructure. The ability to move information is only as good as the technologies that support it. So more system modernization with new IT models such as ASP and BPO and SAS, software as a service. We're also seeing more cloud computing emerge. With that, a greater emphasis on how to cope with health insurance exchanges, both public and private, to improve the ability for them to communicate and improve the ability for analytics and BI. Finally, we're seeing a move towards stronger provider engagement. Providers are essential to the healthcare system. They deliver the care. Health insurance companies effectively purchase physician and hospital services at wholesale through discounts and other means, repackages and remarkets that at retail through premiums. In a very simple way, providers are the supply chain for healthcare payers, and payers need to invest in stronger provider engagement to make all of this happen. Information innovation, then, is the competition frontier. It's the ability to take raw data, apply transactions to it, and come up with derived data. It's also the ability to take information, raw data, create value from it, and come up with inferred data. Well, what's an example of that? If I have a claim for a pharmaceutical treatment, a pharmacy claim, that pharmacy claim consists of multiple parts. It has the name of the patient, the name of the pharmacy, the prescription drug being offered, the number of treatments and units that are being prescribed, and the cost. Those are all transactional value statements in which the health plan owns the information and from that derives value. The problem is it doesn't create new value. And an example would be that same pharmacy claim, but looking at it to determine that it's a 30-day supply of a maintenance drug, but that patient isn't refilling it every 30 days, they're refilling it every 40 or 45 days. Is that information necessary to process the claim, to complete the transaction? No, but it's the essential value proposition that you take when you move that raw data into an inferred data requirement. This differentiation between derived data and inferred data is what we call data kinetics. It's the movement of information back and forth between various elements. IT leaders, CIOs and their reports, who understand the value of data kinetics are the ones who will help their organization move forward. Part of this is their understanding of what we call dark data. That's information the healthcare payer has, but may have forgotten that they own or may have forgotten that they have it in their files. Think of it as shoes in the back of your closet. You've bought those shoes, you've worn those shoes, but over time you've forgotten about them and they've become shoved to the back of the closet. Then one day you drop a tie or push a shirt aside and see those shoes. That's the dark data, information that you have that you forgot about. And IT leaders are able to take dark data and turn it into value for the organization. All of this is in the context of big data, the moving back and forth between various sources of information to create value. So where does that take us and how does that relate to exchanges? Well, we need to talk about the move from a B2C into how exchanges, both public and private, are shifting the market. We start with the consumerism context. Consumerism is the focus on the individual buyer with a variety of marketing and product services that reflect personalized needs. At one end, we have the traditional group benefits plan with a consolidated purchaser of choice. Over time, group benefits have gone into more consumer choice and, frankly, consumer risk sharing. It pushes the individual choice farther along than the consolidated purchaser choice. It also increases the technology complexity. We are now seeing the rise of the public marketplace or exchange, which has even more individual consumer choice, and as we've seen, more technology complexity. To cope with the changing consumers, many health insurance companies are establishing their own single-payer sales tool. That is, offering their own services through different marketing techniques. It is technologically complex, and it gives greater individual consumer choice. But where we're going, where the market needs to be, is this public marketplace or exchange. It's this individual, consumer of one decision-making. It is also, though, the most technologically complex, the hardest to integrate, and the most challenging for IT leaders to make work. So, how do we go from here? Well, let's talk a bit about the Affordable Care Act. And I say this totally apolitically. It's been a journey from hope to, as it was described by senior administration officials, as a train wreck, but it's now coming back to a journey of hope. The law is dense. It has lots of layers and meanings and actions and some unknown consequences, and it leaves much to the discretion of the Secretary of Health and Human Services. But we knew this going in, and health plans have generally accepted their part, although at times reluctantly, to make exchanges work. And the density in rulemaking has made it even more important that payers take up the challenge of making the public exchanges work. Unfolding, though, is some late-breaking changes with a short planning horizon. There are four major IT hurdles of the Affordable Care Act that we need to go through. Exchange interfaces, the 834 transaction correction and manipulation, the 820 transaction member and government billing, and the 835 claim pricing and processing. And this just in, multiple product compliance issues. The exchange interface was probably the most difficult to accomplish. The trip to the marketplace was long and at times error-ridden. Capturing information was spotty and error-prone. But we're about to see the rollout of the Marketplace 2.0, and it may not be called that, but essentially it is the rebuilt exchange, taking in the lessons that we've learned from last fall and making them happen now. It is this parallel activity of continuing to execute on what they have with how do we get the most out of the business. And these exchange interplaces are moving from a disjointed element to a combined and blended element. With that, more transactions, the 834 transactions, need to be corrected and manipulated. These are standard transactions, but let's face it, variations exist and will continue. Currently, it's highly scrubbed and somewhat manual. With that, you have errors. However, this is improving, and tools are available to help the 834 move through the process more efficiently and with a greater chance of correct activity. The 820 transaction, which is the billing transaction, does allow the two-party billing structure. It does have some issues that if the member doesn't pay, does that equal a zero pay in which they're disenrolled, or does it mean that they simply forgot a payment. One of the issues that we found was that about 26% of enrollees in exchanges, public exchanges, don't have bank accounts. So it becomes a very difficult issue to resolve government billing. With that, we have some retroactive enrollment and disenrollment and some manual processing, which creates its own issues of error and correction. And then finally, we have the 835 transaction. This is the claim pricing and processing. It is the concern about narrow networks, about smaller groups of providers and hospitals. It deals with multiple product relationships, and it gives issues around the remittance advice and how that remittance advice works. So what does all of this mean? What's yet to come? Well, we will continue to see code set variability. In other words, lots of subtexts to the individual transaction. We're going to see regulation changes and a rise in private exchanges. We're going to be seeing quality ratings increase in their importance. And let's face it, we're going to see data breaches that are looming, and hacking has already happened. So what's the challenge? The challenge for healthcare payers and those that serve them is to look at the fundamental business drivers that are happening, recognize the change in the role of the consumer, and push the organization forward through IT to recognize this new operating environment. Some plans will be up to the challenge. Others will need help. And some plans won't be able to meet the challenge. It is all up to the healthcare industry to make itself successful. Thank you.
Bob, thank you. Bob Booz is a Research Vice President and Distinguished Analyst at Gartner. So with all the issues and concerns that Bob raised, where can healthcare providers turn for help to succeed in the new emerging marketplace? For more and more, the answer is Softheon. And we're joined now by Softheon's founder, Eugene Sayan, who is the company's chairman, CEO, and president. And Eugene, I know you have a lot you want to address in what Bob just said, so I'll let you take it from here.
Bob, thank you so much, and Gartner, thank you for this wonderful opportunity to spend some time with you about the great changes that are kind of sweeping through the healthcare industry. My portion of the presentation will be more geared towards the marketplaces and then the use of technology and new business processes that is driving this very disruptive behavior or change that we are seeing within the industry. And before I deeper dive into the problem itself, maybe a good thing to just talk about Softeon a little bit. In a way, we take great pride of the type of organizations that Softeon has been or continues to bring a very unique value to both on the industry as well as consumer side. We are roughly about 100 people. We are an engineering company. I am proud to say that basically many individuals in the company, we love data, we love technology, and we believe that brings a great dynamics and great diversity kind of as an asset out-of-the-box thinking process, if you will, which is being greatly valued by our healthcare plan partners. And we are also unique thing. One more thing about Softheon is a very unique, is we operate from the grounds of a public research facility in Northeast, Stony Brook University. Being such a strong roots in academia, we interact with over 200 or so PhDs and postdocs and computer science grads. And we love tackling unique technologies, let it be transactional processing or big data, natural language predictive modeling. So over the last several years, we focused on bringing those core assets, if you will, in a very unique way that is being kind of put to test by our early adapters, as we call it. I'm happy to report to you today that we have over 50 health plans of various sizes, some national health plans. Many of them are what I would call it a regional health plans, and basically benefiting and leveraging that common source of truth that Softheon technology brings to these organizations. And we take great pride about consumer education, in this case, our plan education, how we educate that translation, if you will, of the technology as it becomes applicable to the day-to-day operation of a health plan executives. For that matter, we encourage the audience to come in and visit us at Softheon.com, and you will see something in line of Health Connector, Softheon Connector newsletter. And it's a free complimentary service. It is designed to keep you up to date with day-to-day changes and news are taking place in the industry itself as it relates to marketplaces. So why the marketplaces? Softheon being a technology company, of course, that we are looking to bring some disruption of our own in the industry. But as quoted by Mark Bertolini, Aetna CEO, just the beginning of 2014, that 75 million plus will be buying their healthcare insurances through the exchanges. He proceeded to say about 20 million or 25 million will be through the public exchanges and remaining will be through the private exchanges. In our view, those numbers are in fact somewhat maybe conservative. Our analytics leads us to believe that if we take into 270 plus million people qualify for insurance, and of that 47 million people uninsured, given the advent of ACA and Obamacare, we believe that in addition to that, nearly 60 plus million people will be previously covered but dropping their current coverages and will be moving to these individual exchanges, let it be on the public or private side. So our estimates, in line of many others, let it be McKinsey or Accenture, we believe nearly 100 plus million people will be purchasing their insurance coverages, if you will, through the internet, through the private and public exchanges. So in that context, the public exchanges continues to be one of the main driver, as you know it. As we know, in 2014 was an exciting year. This was the biggest, probably single most important event since the introduction of the Medicare and Medicaid. Over 8 plus million people have purchased their basically first-time coverage, most of them, if not some, basically a small percentage of them, have basically acquired their first time ever, got into the market, if you will. And as we look into that market, as you know, that roughly about 27 states continue to operate in a pure federal exchange model, whereas other 14 states are in a state-based marketplaces. A lot of big California, New York, Washington are being the leading one, if you will, with the highest new membership counts altogether. We have 7 states in state partnership models, and then the 3 is in a quasi mode, if you will, as you will imagine. In some of these states, as you know, were especially Oregon and Nevada, New Mexico, these states are in a little bit of an influx. They had an attempt last year, did not go well. So this year they're an FFM model, but they still consider themselves as a state-based marketplaces. Having said that, I think that the overall presence of marketplaces is gaining ground. Initial kind of political, without going into my political affiliation, I believe most of the arguments now is being kind of subsided, if nothing else gone. So clearly there is a need in the marketplaces. If you look into it, even on the low end of the market, 18 to 25, there was 11% of the members came from a demographic point of view, came from 18 to 25-year-old age group. The largest age group still represents the 45 to 54, roughly about 23, and then we have over 25% of also in the 55 plus age group. So there is definitely a great need for an affordable and even if it might be a basic, but it's nevertheless as a health insurance coverages. 68% of our memberships came from the federal marketplaces, where 32% came from the state-based marketplaces. And then I will say probably about 54% female and 46% male enrollment. And these numbers, by the way, we have generated through mainly our sources, mainly from the Softy enrollments, which we'll talk about a little bit more in detail. 72% of the states said that they will make an entry into the next year's marketplaces. We believe that the FFM issuers, we roughly about 250 or so. This is an increase over 190 plans were offered or issuers were participating in the marketplaces last year. And the same kind of a small increments, you'll see it on the state-based marketplaces as well. there will be about 77 new issuers offering QHPs in 2015. So clearly, there is a great momentum towards the marketplaces, even though, again, despite some of the earlier political affiliations, we're seeing that overall need for an affordable health plans, health coverage, if you will. It is something that is being validated with that level of interest. Again, earlier, about several weeks ago, we heard that revised projections for 2015 enrollments. In our opinion, that will be slightly more than 10 million. I think that we believe that overall numbers could be anywhere from 12 to 13 million lives covered after the open enrollment ends in early part of 2015. In addition to that, private exchange markets are heating up. As you know, that organizations like Tower Watson's, Aon Hewitt, or even on the low-end markets, Bloom Health is being funded by several of the Blues, are making some big commitments into the private exchange market, and we believe that market will continue to grow. We think that will take some time. The biggest growth in that market, we expect that to be in 2016 and beyond. So it will be some time in that market space. And again, there are various statistics to be shared. Let it be the number of employees trying to get into that market. We're also hearing organizations are dropping their coverages for their full-time employees and part-time employees and basically moving them along the way to the public and private exchanges, let it be Walmart or even Walgreens. Overall market, again, by 2018, the private marketplaces, we think that about 40 to 50 million lives will be covered under private exchanges. This is, again, on top of 25, 30 million people expected to be in ACA public exchanges altogether. So clearly there is a great momentum. There is a great shift towards that industry altogether. So given this market opportunities, we see that something is very challenging for the health plans of today. You know, as the old saying that what made you successful last 5-10 years doesn't guarantee your success in the next 5-10 years. As Bob alluded earlier about the healthcare industry making transformation from B2B business model to the B2C business model, as he talked about the nexus of forces, let it be social and mobile or cloud computing, and that in this case we'll talk more about it, is truly making that transformation possible. That couldn't be realized if it was 5 or 10 years ago. So in that context, this is where Softheon value proposition comes in. As a technology company, we've extended our offerings to what we call a marketplace cloud. And basically, Softheon Marketplace Cloud, it provides our health plans the opportunity to take all their operations, all their challenges, let it be initial outreach, enrollment, eligibility component to it, or let it be ongoing ACA regulatory compliance around the grace periods or the binding payment notions and so on and so forth, or it could be on a recurring basis, making sure that invoices go out on a timely basis or collecting those revenues on a timely basis. Softheon Cloud, Marketplace Cloud, is exactly designed, ground-up designed to address all the critical components of starting with ACA marketplaces, subsequently with the private exchanges as well. In that Softheon Cloud today, I'm happy to report to you that we also bring some great partners, as we call it, our cloud ecosystem altogether, partner like such as Bank of America or Visa, are critical elements of our total value proposition, how we handle the credit card payments, for instance, with the carrier's branded look and feels, or to the direct enrollment interfaces, talking directly to the Federal Data Hub and offering different products and services around the individual's ability to participate in these exchanges. It is a very complex system, by all means, and we take great pride. You know, we always, as we call it here, any fool can design a complex system. Really, is the big challenge is about putting together something simple. And simple in the essence that it's simple to implement and simple to operate. In that context, I'm happy to report to you that our onboarding process, onboarding a new carrier to Softheon Cloud, now we count them in days. It's not even weeks, it's not even months anymore. Whereas a technology project of its size and complexity historically would have been an 18 months or a year, multi-year project. We are able to bring that down with the different elements of cloud computing. And as we go deeper dive into the We'll talk specific elements or specific components of the cloud altogether. And so the consumerism is critical driver of this effort altogether. And consumers, as we all know it, that their loyalty is skin deep. And in the internet age, consumers, especially the younger demographics, their brand loyalty is basically, it just follows where they think that they're getting their value for what they pay for it. In the overall scheme of things that on Softheon marketplaces or cloud implementations as we know it, we have about 14% cancellation rates. We see it about 7% terminations, and in a given time, about 6% of the people are waiting for their initial binding payments per ACA to be effectuated. So in an overall scheme, we have about 73% effectuation rates, and we believe these numbers will continue. And in fact, we may have even a higher attrition rate. So the key point is about keeping track of those individuals. Another interesting statistics about the marketplace consumer behavior is the use of credit card. Now, Softeon has been engaged with the nation's first state exchange dating back to 2008. In all that 4 or 5 years of operation, we didn't have basically over 20% of our memberships came in, basically interacted us via websites. Main interaction was always been around papers or in phone calls with the contact centers and so on and so forth. What is surprising about a post-ACA, about 64% of our members are actually making their premium payments by credit card. Now, you may think that's no shocker given the kind of overall consumer behavior as they interact with Amazon.coms or Travelocity or other type of online e-commerce entities, if you will. For an insurance company, this represents a big challenge because this merchant fees that let it be 2%, 3%, up to 5% in some cases, that represents a significant percentage of the premiums, so that the carrier needs to be really kind of fully aware of it. As I mentioned earlier, is about that, what Softheon has done in the cloud settings. We call Softheon basically the interstate highway system of exchanges. I am proud to say that we are practically connected to every one of the federal and state exchanges, which means we have been able to send an 834, we have been able to receive, we have been able to audit and reconcile, which means we are able to do at the federal level a real-time enrollment eligibility with the subsidy verification through interface called direct enrollment. We are able to provide an ongoing ACA-compliant premium billing, collections, subsidy calculations, CMS audit reconciliation. In the context of this Softheon's interstate highway of exchanges, in other words, we have basically paved the road from all these different destination points, and your starting point being your existing core admin system, let it be systems like Facets and QNX and Amisys and ICA systems and so on and so forth. We were able to interconnect these two entities. By doing so, our tagline, in fact, to our health plans is, why are you building your own road from where you are to your exchanges altogether? Instead, you can literally put your cars and trucks on the Softheon highway, and as long as you don't mind paying as small tolls as you drive, it certainly beats the heck out of building your own road, if you will. And by doing so, Softheon able to eliminate and basically remove all risk associated with building this very complex system to begin with, and to be able to not only initial implementation, but also the ongoing recurring costs associated with these marketplaces. So historically, this is the biggest value and differentiation, that in the marketplaces, that if you wanted to build a technology like these in the past, you had to build an enterprise application platform, build hardware and software, and more importantly, you will have to get your hands on the highly qualified subject matter experts who can come in and build a system of this kind and make sure that system operates within the specification. More importantly, on a recurring basis, ongoing basis, system is being maintained and supported. Whereas in the Softheon world, and Softheon is not the only company in that context, by the way, there are other cloud companies that we are seeing a great penetration in different parts of healthcare, not just about the marketplaces, let it be on the well-being, price transparency, there is a great proliferation of a cloud-based technology companies are really coming up with a great creative product and services targeting the healthcare payer and healthcare delivery systems altogether. As a cloud provider, we are able to provide a technology platform that basically does require no software and no hardware to be purchased by our clients, and more importantly, no maintenance. And the ROI speaks for itself. Our typical implementation nowadays is less than 30 days. And based on several industry metrics, that typical project like these will take anywhere from 6 months to a year if you were to do a traditional enterprise model computing altogether. So our success story continues to evolve over the last 90 plus days. I'm happy to say that we've achieved our highest quarterly new client ranking. I'm happy to say that we have now over 50 health plans using Softheon technology in whole or parts for the ACA Marketplace implementation. Last year, we've exceeded our 500,000 lives mark. We're expecting to enroll over 1 million lives on Softeon platform, meaning Softeon, one shape or form, responsible of that individual well-beings and receiving the healthcare coverage, if you will, through ACA Marketplaces as well as private exchanges. We'll talk also as we move forward. So the exciting thing for us on health plan perspective, last year we processed nearly $350 million worth of premiums. We project that premiums to be in excess of $1 billion this year. So I'm happy to say that our PayPal unit, if you will, has also been extremely successful. So let's talk about the eventuality of Marketplace 2.0. Is another token that I borrow from my good friend Bob. Basically, as Bob talks about ACA as being the step one, there are going to be multiple steps. In fact, some of those already has been moving before the ACA. But more importantly, more recently, in fact, WellPoint made an announcement on October 29th of this year that basically they lost another 300,000 lives from their small group coverage. And their total coverage down to now 1.5 million small group. Now, WellPoint, again, 20 plus million lives they covered. It still represents a shift in dynamics in industry that basically we believe the small group market, for the most part, will be absorbed by the individual markets, even to a certain extent, I will say, the large group market, especially those part-timers or the people that are making certain income, so to speak, will be much better suited, much better qualified, better health plans perhaps on the public or even private exchanges, especially if you take into account like defined contributions. So our definition of Marketplace 2.0, as I always call it, is imagine if I was an airline CEO, if you will, you will not catch a Delta CEO quoting saying, we are only going to sell our planes on Expedia. We're not going to sell our plane tickets on Travelocity or Pricelines and a few other, right? It would not make any sense. We believe that the healthcare industry is also in this similar type of transitions. So ACA being the primary marketplace, we're already seeing that other marketplaces are being formed. Let it be healthinsurance.coms or let it be, again, Aon Hewitt's and so on and so forth. So in the context of it, where the biggest differentiator in the multi-carrier exchanges, as we call it, is the biggest differentiator probably is the price and the conveniency, meaning that having enough flight to go from point A to point B, I really don't care even if I have to change flights or planes. I may go to LA and United, I may come back on Delta. Hence the formation of what I call the Star Alliances. So these kind of very price competitive, consumer-friendly, consumer-competitive marketplaces is continuing to evolve, and that's going to be the biggest marketplace. But I also think that there's going to be a growing need for what we call it a single carrier exchanges, i.e. is that the Delta.com, for instance, will be a great example. So just because Delta sells their tickets on Expedia Travelocity doesn't stop them from offering these product and services to their basically ultimately what I will call the VIP customers. Delta.com in that context offer product and services that is not matched, so to speak, by marketplace definitions, because the value of Delta.com over Expedia is the value of the services, the value-added services that consumers are able to get. Let it be upgrading their tickets, depending upon the frequent flyer status, able to redeem their points. These capabilities do not exist within the marketplaces or consumer marketplaces, multi-carrier marketplaces, because that's not something that's able to do that. So we're seeing our carriers, as we engage them, phase one, as we call the multi-carriers, 50-plus health carriers. We are now actually have built each and every one of them their own dedicated marketplaces as well, too. So to us, that's the biggest transformation. So as we move forward, we see that industry is forming and turning into truly a consortium. As I mentioned that to you earlier, that we have partnership with Visa and partnership with First Data, partnership with Bank of America. We think that there are other companies, organizations will come into the marketplaces. And our goal is there, as we call the Davids and the Goliaths. In the early days, there were giants like Pan Am's and TWA or Eastern are being now replaced by JetBlues of the world and Southwest and even Virgin America. There's going to be a lot of newcomers. And by the way, whatever is happening here in industry-wide over the next 5 years will have an overarching effect, global effect, perhaps, in other parts of the world where historically the way the industry worked in the U.S., it's been very much a U.S. only, even to a certain extent, state-based plans. We are now seeing the great disruptors evolving, coming into their places. Companies like Oscar Health being able to raise a newly startup company with a handful of employees, raise nearly over $100+ million with a market cap of $1 billion. Now, this is a company never done any business, never done any enrolled individuals or delivered care, but we are seeing a great appetite and great excitement and great hopes about how the industry is evolving and changing. And Softeon is great to be a part of this exciting time, if you will. And more importantly, we are truly honored and privileged to be selected as a trusted partner to many of our health plans. With that in mind, I'll turn over back to you.
Eugene, thank you very much. And now let's bring Gartner analyst Bob Booz back into the conversation as we have some follow-up questions for both speakers. And Bob, I'll put this first one to you. How will the consumer deal with the exchange?
Consumers are the heart of the exchange. They're what make it work. And so consumers need to be improved in their ability to make decisions, what we call the smart consumer. The smart consumer has the tools and information available to them to make smart decisions about products they buy, services they seek, and healthcare they receive. Organizations that create the smart consumer are the ones who are going to succeed in the market.
Eugene, we hear a lot of concerns about safety and the like. Is cloud technology mature enough for the healthcare industry?
The answer is yes. Cloud technology has been in effect many parts of your day-to-day lives. If you are using Facebook, not only for your personal anymore, what used to be a personal thing, but if your company is using Facebook, you are pretty much a cloud computing user. If you are doing any kind of financial transactions or online banking as a business entity with your financial institutions, you're a cloud company. And in fact, the one part that we got really excited about when the ACA went into effect was our ability to interact both with Federal Data Hub, which basically does all the Homeland Security and IRS and all the other parts of Health and Human Services as far as the individual's ability to receive subsidies. That was done by standard cloud computing interfaces, also commonly referred as web services. So I'm proud to say that technology is, I think, mature at a point that it can be trusted. It is reliable, given the challenges of the federal website marketplaces last year with the, all the downtimes and problem technical glitches and whatnot. I think that was more of an isolated incident. It was an anomaly. I'm really happy to say that was more than the norm. So today we work with 50+ health plans. We interact with CMS, exchanging hundreds of files, 834 files, and as I said, or financial records in some of the states that they are the entity doing the premium billing. We are able to exchange the data safely and securely. and the technology in a way that is very conducive to the consumer-driven models. Our cloud computing can be scaled easily, and at moment's notice, we are able to increase our capacity, given that, again, some of the technical capabilities that organization may or may not have. But the cloud companies are designed to survive and thrive in this kind of environment altogether, where the consumer demand can vary, can fluctuate greatly. A technology like this, if it had to be implemented at a health plan level, you will end up buying basically servers that are being used extensively only during the open enrollment season, because those are the 3-4 months that you're going to get that millions of users coming and visiting. So what's going to happen after that 9 months or the other 9 months or durations that we don't have a peak demand on this technology? Cloud companies like Softheon is designed to handle and basically thrive upon those certain uncertainties. We have health plans enrolled in handful of, and then whereas the others enrolled 40, 50,000 in their first year of operation. Once again, working and collaborating with a cloud-based technology company will enable you that level of agility, if you will, as the market needs shift, changes, that your business needs and your technology capabilities can also has to align with those things. And overall, I think cloud is a way to go, as Bob calls it, one of the 4 nexus of forms. And if you combine that, in fact, with the effect of social media as well as mobile computing, and we view all of them as part of a critical component of our cloud infrastructure. And Softheon today, I'm happy to say, our entire 100% of our technology runs on the cloud, and we are making great inroads into the mobile computing as well as social media, social computing, as we call it here. And we are, as I mentioned at the beginning of my presentation, that we are being a bunch of the data scientists here. This is exactly the place that we like to be in terms of our know-how, our skill set, and our value that we bring to our health plans.
Bob, you talked about the consumerism context and how consolidated consumer choice moves to individual consumer choice. How can we help this happen?
Organizations that want to improve the consumerism context have the ability to offer multiple products at multiple price points in new and different ways. With that, they can give individuals access points into their healthcare benefits through public exchanges, through this single-payer sales tool, and through the public exchange or public marketplace. With that, they have the ability to offer multiple products and allow for individual searches of information to improve the decision-making characteristics. It means getting in front of the consumer, offering them better services, and then having the technology to support it.
Eugene, turning back to you, what are the biggest challenges for the ACA marketplaces, and where do you see the sustainability?
And again, I think the ACA, aka Obamacare, it really was a mandate. And there's nothing gets industries or individuals' attention like a mandate, a law says you must do this. And clearly, what ACA did was simply, as I call it here, kind of hit the pedal to the metal, if you will, and accelerated the industry's move already when being moved. Prior to ACA, consumer-directed health plans, high-deductible health plans were growing about 18% a year on average, whereas, as we pointed out earlier, that the small group market is pretty much evaporating for many of the national, especially national health plans. So the effect of the ACA, it just simply was an acceleration of that shift, if you will, from your typical B2B business model, as Bob put it together, to the B2C, or versus that, consumer back to business, C2B model. So we think that will be a kind of a catalyst towards getting the initial momentum, if you will. And we think that over the next 2-3 years, that shift will be, momentum will be shifted towards the private exchanges, especially on the defined contribution model, as well as other kind of amenities, upselling or cross-selling or bundling, dental, vision, health, even property casualty. We have health plans that are considering offering products that are complementary to not just the health insurance. I think the key thing about ACA's sustainability is a great question to be answered. in our view is that the membership counts is going to reach a certain point, and if it is indeed reaches at 12, 13 million people this year, and with momentum to reach nearly 18, 20 million next year, I think at that point, the repeal and replace will be something that is going to be difficult to attain. I think that law has some challenges, as being reminded by multiple times. Again, no affiliation, no political affiliation. There are some small, in our views, that small unfairness. For instance, if you are in an FFM state, in a federal exchange, you are able to build a direct enrollment site where you can sell to the consumer directly, and upon getting the consumer's subsidy, or better yet, APTC, I also don't like to use the term subsidy, as an advanced payment tax credit. And you're able to do so right through from your branded health plan website. But if you are in one of those states that you're under the state-based marketplaces, you don't have that capability. So there are a lot of small issues along the way. We believe in the long run the system will be well served, if you will. The health plans are in charge of engaging with consumer, which they are already doing that, have been doing that. And basically the things like subsidy or APTC tax calculators, if you will, or overall ongoing billing and whatnot, that will be absorbed by the health plans and turned into a more of a commercial product offering, if you will. And I believe the industry, as a commercial entities, very successfully ran and built, they will manage. They will bring the cost and the savings along with a level of automation, level of efficiencies that will come from the extensive use of technology.
Well, we're running out of time, so we'll have to let that be the last word. A quick bit of bookkeeping. Gartner is an impartial, independent analyst of the information technology industry. All content provided by other enterprises is expressly the views of those enterprises and the speakers. The information should not be construed as a Gartner endorsement of said enterprises' products or services. And with that out of the way, let's again thank our speakers, Gartner Research Vice President and Distinguished Analyst Bob Booz, and Softheon founder, chairman, CEO, and president, Eugene Sayan, for their insights and advice. And thank you, our audience, for your time and interest. To learn more on this, please go to www.softheon.com. Thank you.